Most people that come to see me to treat their toenail fungus have already tried pills, also known as oral medications, or have even heard about laser treatment of toenail fungus, but they're not quite sure which option they should go with. So today I'm going to walk you through both. We're going to do a little bit of a deep dive on treating toenail fungus with laser versus pills so that you can make the best decision for you on what's right for you, your body, and your goals. My name is Dr. Tarr. I'm a board-certified podiatrist in private practice here in Phoenix, Arizona, and I own a practice called Direct Podiatry Arizona in Tempe. Pills for toenail fungus or oral antifungal medications work from the inside out. The most commonly prescribed pill is something called terbinafine. Once you take that pill, it goes to your stomach absorbs it travels through your bloodstream, and reaches your toe and your toenail or nails to stop the fungus where it lives. Itraconazole also can be used, but terbinafine is the drug most commonly prescribed if you're talking about a pill or oral medication for toenail fungus. With terbinafine specifically, you take one tablet once a day for 3 months and then you stop. Sometimes occasionally use what we call a booster dose. So after that 3 months, maybe if that toenail fungus starts to return, then your doctor will put you on it for another month and then stop it. Now, this medicine does stay in your system for a lot longer than 3 months and continues to work and attack the fungus even after you've stopped the medication. The thing is, and if you're someone going through toenail fungus right now and you're looking at your treatment options, maybe this has come up on your search, is that one of the side effects that's commonly talked about with these medications is liver damage. Research has shown that the percentage of people that had their liver affected by oral antifungals or medications for toenail fungus is around 5%. At the end of the day, if you end up being one of those 5% that's affected, that matters. That's important. So I try not to use that number as a way to sway people towards oral antifungals if their heart truly isn't in it. But this risk can be controlled, and we control that through blood tests. To be on the safe side, any doctor that is prescribing you these medications should order labs on you in the beginning before you start this medication to be sure you don't have any underlying liver issues that you don't know about. And then we order labs again at the 6-week mark to be sure that your liver is still healthy. And if we see your liver function start to increase or creep up, we stop the medication. Your liver function or your liver enzymes will go down, and usually no permanent damage is done. And then towards the end, at your 12-week mark, we'll order one more set of labs if you've continued to do well on terbinafine or other oral antifungal medications. So now, some people that definitely are not candidates for pills to treat their toenail fungus is anyone with a history of liver disease. So fatty liver disease, hepatitis, liver cancer, you name it. If you have any sort of problems with your liver, health-wise, you're not a candidate for pills for treating your toenail fungus because, again, these medications more than likely will exacerbate what you already have going on, and we don't want to do that. Some other side effects that can come up with pills or oral medication for toenail fungus treatment, allergies. I've had some patients who have been on these medications in the past and they've dealt with rashes that pop up and nausea, vomiting as well. These are things to keep in mind. Not to say that all these things will happen to you, but if you're going down the road of looking for ways to treat your toenail fungus and you're interested in oral medications, these are some of the more commonly reported side effects. So how well do pills work to treat toenail fungus? So in a long-term follow-up study known as the LION study, even though researchers found that these medications definitely do clear toenail fungus infection, the chances that your toenail fungus will come back is commonly reported. And this is about 50% of people in the first year will see their toenail fungus return when they've been on these medications, and upwards of 75% in 5 years have their toenail fungus come back. So another 5-year study that compared the two most commonly prescribed drugs for toenail fungus, terbinafine and itraconazole, found that terbinafine had lower relapse rates than itraconazole. Terbinafine was about 23% of people that took it had their toenail fungus return versus 53% for itraconazole had their toenail fungus return. So again, that's why, especially most podiatrists, if they're going to prescribe a pill to treat your toenail fungus, they will stick with terbinafine more often than not. And sustained cure, or how long the fungus stayed away years after the treatment was done, was 46% for terbinafine and only 13% for itraconazole. So again, terbinafine. Oral therapy or pills for toenail fungus can work, but as I've talked about in my other videos to this series on treating toenail fungus with laser, combination therapy, looking at your lifestyle is also very important, no matter what road you decide to go down. You want a doctor that takes a whole body approach, looks at your shoe hygiene, blood flow to your toes, diet, and immune health as well, and any other health problems that you have underlying. Laser treatment for toenail fungus, on the other hand, works very differently than how pills work to treat toenail fungus. So instead of targeting the fungus through your bloodstream, it uses a specific wavelength or energy of light directed at your toe, at your toenail, and at your nail root to stimulate an increased immune response and get your body over time to clear this fungus infection. I do have a video that breaks down the science step by step of how laser for toenail fungus works. So if you're interested in a deep dive on that topic, feel free to click this video here. Through a process called photobiomodulation, laser for toenail fungus increases circulation to your toes, helps your body cells make more ATP that's used for energy, and create an environment where fungus just cannot thrive. A 2019 meta-analysis across 35 studies and 1,700 patients showed that laser cure for toenail fungus was about 63%. And a 2024 systematic review compared actually laser and oral medication or pills to treat toenail fungus. Laser results were actually very comparable to terbinafine specifically, but with far fewer side effects, like the increase in liver function, allergic reactions, nausea, vomiting. But the authors of this study did also emphasize that more high-quality studies are needed, which I agree. Other smaller studies comparing laser treatment for toenail fungus and using pills to treat toenail fungus, especially class 4 laser, is a newer technology than something like terbinafine that has been around for decades. So terbinafine in these studies definitely did show higher cure rates just because there's more studies available on terbinafine versus laser to treat toenail fungus. About 80 to 85%. Laser therapies on average have about a 60 to 70% cure rate. Everything in medicine is not for everyone, and laser definitely isn't for everyone, just like oral medications are not for everyone. If you're someone that has been diagnosed with peripheral arterial disease or peripheral vascular disease, if you are pregnant, if you have epilepsy triggered by flashing lights, or you have any photosensitivity disorders, laser therapy for toenail fungus is not for you. It's so important that when you're weighing your options between pills or oral medication versus laser, you have a doctor evaluate you. We can look over your history and see which option will work best for you. The best results, whether you're using pills to treat toenail fungus or laser, definitely come from a combination therapy approach. And I harp on this in every single video. I talk about combination therapy for toenail fungus because, again, toenail fungus is so hard to treat. It's a fungus. Fungus cells are more similar to our own body cells than something like a bacteria. So it can be more difficult to pinpoint those cells and get rid of them without harming our own body cells. So we want to attack this fungus from a lot of different angles. So on top of whether you choose laser or pills, you want to look at topical treatments, like a clear lacquer that you would paint on your nails that are affected daily. Medicated foot soaks as well help, in addition to all these other things in treating your toenail fungus. Again, as I always say with any of my toenail fungus videos, you want to look at your diet, your lifestyle, sleep, stress, any other health problems that you have going on. Because again, there is an underlying reason why this fungus has stuck around for so long. So getting to the root cause, I'm big on that, on why this toenail fungus has refused to clear and removing those barriers to get you to heal and produce clear, healthy, beautiful nails again. Disinfecting your shoes or cleaning the inside of your shoes, not sharing shoes or socks, not walking barefoot in public spaces, being sure to disinfect tubs, showers that you're using at home, not sharing nail tools with other people, definitely not going to nail salons that don't autoclave their instruments. All these things can help control your toenail fungus and keep your nail fungus from coming back. My goal with building my practice was to give people options. Laser therapy now is becoming more popular, but it's still not something that everyone offers. So I'm very fortunate and honored to be able to offer the Remy laser in the Phoenix area. That is it, everyone. My video on laser versus oral medication or pills to treat toenail fungus. If you are in Phoenix and interested in scheduling a consultation with me to see which option is right for you, I will leave a link in the description box. I have my playlist on all the other videos I've made talking about laser treatment for toenail fungus and just toenail fungus in general. So until then, everyone, take care and wishing you good health. Bye.